what are the pros and cons of working with my local primary care physician? Everyone loves to work with specialist doctors. Why is that? Well, there's this perceived value that I'm working with somebody who's the best, or they only think about this one area that I'm struggling with, okay? But the reality is that's not how the healthcare system in America works. You must have a relationship with a primary care physician so that you can be referred to a specialist. In this article, what I want to do is I want to talk about the pros of working with a primary care doctor, the cons of working with a primary care doctor, and then third, when does it make sense to work with Tiger Medical, a specialty clinic, okay? So from a pro standpoint, there's like 4 or 5 of them. First one is accessibility, okay? Your local doctor is very accessible. You can get in usually within a day or 3 days, and that's going to be a lot better than flying someplace for some routine issue. The other thing is familiarity. Your doctor knows you. They know your health history. They've been with you. They probably know context in your family environment, what's going on locally in the community. Those are all things that are really important. Third, they're comprehensive in nature. They're trained to look at everything going on in your life. And then also they become very crucial if you get sick and you need different specialists. They're going to help coordinate care. There's a lot of positives. Now, what are some of the cons? Well, one of them is they do have limited expertise. They go an inch deep and a mile wide. That's what their job is, okay? These are highly trained clinicians, but they're simply not equipped to have specialized expertise in every area of medicine. That's impossible, okay? To expect that is inappropriate. The other thing is they're extraordinarily busy. These folks work very hard just to face the onslaught on a daily basis, especially doctors who work in hospital systems where they keep ratcheting up the requirements to make the numbers work. Third, they are restricted significantly by insurance companies in terms of the kinds of testing they can do. So that's why clinics like Tiger exist, because we don't have those limitations because we've opted out of the insurance system. And then fourth, because there are, in many areas, there are shortages of primary care physicians, or there's just too many people consuming their services, you can have a limited availability, okay? So those are challenges, all right? Why work with a specialty clinic like Tiger? Well, what we do is we're focused on advanced restorative medicine. We're gonna help restore and optimize the health of a driven professional who has achieved a lot of success, but feels like they've compromised their health to a degree. They've worked on success more, or meeting the needs of others, but maybe not taking care of themselves the way they could. And they are worried that this is going to show up big later in life when they should be enjoying themselves more. So they come and they work with Tiger to get ahead of these things and be proactive about their health as a health investor, okay? Now, what Tiger does is we employ a 3-step process that I talk about all the time. We use advanced comprehensive testing to find those underlying mechanisms that are driving your symptoms, all right? We want to get to the truth, all right? Because once we understand the truth, we can deal with it, okay? The next thing is we're going to customize, personalize your treatment plan based on that advanced testing and genetic testing, okay? And once we have all of the truth, once we have the personalized plan, we're going to have you enter into a process with primarily a health coach, but also your doctor. And we're going to implement that plan with you, holding you accountable to make those changes, plus the 8 Tiger health habits. It's the integration of those 8 health habits along with the personalized treatment plan that synergizes and creates all the great results that we get here at Tiger. Now, let me tell you this last thing. It's really important to understand. If you hear nothing else, hear this. We are not primary care physicians at Tiger Medical. We augment and support the work that you're doing with your primary care doctor. So we will always say, maintain a relationship with a primary care doctor, share with them what you're doing with us. We're happy to share what we're doing with your doctor and all the results so that you can get the best possible health care. Now, next steps. All right, a couple things you can do. One, You can continue to look around in our learning center and learn more about the symptoms and problems that you're having. And then if you've got a level of comfort, I think the next best step for you is to book a call with us, book a free health assessment. A professional at Tiger will get on there with you, and they'll really help you dig deep into if we're a good fit for you or not. If we are, well, he'll tell you or she'll tell you the next steps in your journey to beginning to work with Tiger to restore the health that you're looking for. I hope this was helpful. Have a great day.